targeted groups, with the active sexuality, etc., for example. But also we want to start at the lower level possible in the schools. And there are some public campaigns, not only on the TV, but also in the schools. I do go to speak in the schools to bring awareness. And when the people know it can happen, so this disease is prevented by condoms. So when you have sex with a casual partner, you should use the condom. And then you can decrease so much, the possibility of getting the infection.
I believe the Thai people take it very well about all this education and the information that they're getting. What do you think about other countries, let's say like Africa?
Yeah, so it is all about defining in any country the needs of this prevention campaign and to target this campaign to the people in need. Of course, in Africa, the problem is much bigger than in Asia, and it is a difficult problem to change the behavior of the people. But at least we should repeat that everybody in doubt about any possible infection should not auto-discriminate himself or herself. As the community should not discriminate. It is only a viral infection. And then he or she can go for a test as there is no symptom. And if we see that the test is positive and the level of the CD4 cells went down already, we give the triple therapy and they continue to have a normal life. And the third possibility is, in case the people have symptoms already with AIDS, with opportunistic infection like tuberculosis, meningitis, whatever, we can still fight. Most of the patients are recovering well, but no need to wait for this sickness.
Can this be completely cured?
So, still now in the world, we do not have any medicine which can eradicate the virus, which can cure. But we have this medicine, the antiretroviral drugs, which you need to take every day, like we take for the blood pressure or the diabetes. We don't have the cure of diabetes or blood pressure also.
To control it.
Yes, to control. And by doing so, your immune system is getting back to the normal. You have a normal life, you work normal, and you wait for this day in the future when we will have either a super vaccine or a special genetic treatment, whatever, which will get rid of this pandemic.
Okay. Anything else you'd like to add?
No, I just want to say thank you for Pattaya Mail to bring awareness for this disease with this interview, and to say again the message of prevention. Anyone in doubt should go for a test, and then you can just take this medicine to keep a normal life. Thank you.
Thank you very much.
Yeah.
I'm now sitting with Dr. Olivier Meyer. Dr. Olivier has a clinic at Day Night Hotel, and he's the past president of the Rotary Club Marina, which is the only French-speaking club in Southeast Asia. Good evening, sir.
Good evening.
What brought you to Thailand?
I came first in '87 as a tourist, and I traveled 6 months in Southeast Asia, in India, Nepal, Thailand, Indonesia, Singapore, and I really enjoyed to be in Thailand. And I came back as a tourist, and I had the chance to work as anesthetist with the International Red Cross in 1991 in Aranya Pratet, near the Cambodian border. I worked for the Khmer refugees, and I spent 1 year working with the Thais, and I really enjoyed, and I thought, why not coming to Thailand?
How many patients did you have to deal with every day? People affected by the landmines, I believe?
Between 40 and 60 a day.
Wow.
So the International Red Cross took care of surgery, that means emergencies, but also some cesarean sections. We worked with Médecins Sans Frontières, who took care of internal medicine, and Handicap International. For instance, someone who lost their legs, they need some artificial legs, so Handicap International did them for them.
So how many years has it been now since the last time you were there?
1 year. It
1
was
year
in
ago.
1991.
Oh, you were there for 1 year, but that was in
Yes.
1991.
Yes.
And since then, do you know the situation along the border? Since then?
When I worked there, they began to close the camp and they began to repatriate the refugees because there were no need to have refugees in Thailand. I know they closed the camp in 93, I think.
And what is the situation with the landmines and the people there now? Do you know? Have you looked it up?
It's still very difficult because there are plenty of landmines and they have trails, they know where to walk. The problem is when it's raining because the landmines they can move a little bit, so when it's raining it's dangerous to walk again.
And who's helping them now if the Red Cross is not there anymore?
There are some NGOs over there and they try to clean the landmines, but there are millions and millions
Of landmines. And I'm sure that people are affected by that on a daily basis, but not just the NGOs. Is that enough people helping them, you think?
I didn't go there since a long time.
Alright.
I don't really know.
Yeah, okay. And how long have you been a general practitioner now in Pattaya?
12 years now. I came in Thailand in 96. I worked in Bangkok for 3 years before coming to Pattaya. I had to pass my examinations to get a Thai medical license. I opened my clinic in 99 and now I work as a GP. I'm anesthesiologist and intensive care specialist from Switzerland, but it's more easy to work as a GP here because I work on the front line.
And at your clinic, what do people come in for? What are the most cases?
In Pattaya we have different peoples. We have the tourists and we have the resident and we have what I call the semi-resident. They come in November to Pattaya and leave in March to go back to Europe. So I have patients for the long term for heart problem, high blood pressure, diabetes. I have emergencies as well with tourists and some diarrhea or skin problems or cough. It's everyday work of a GP.
It's just everything and anything, right? And you refer them, if it's serious, you refer them to the hospitals, of course. Right?
We work together. I work as a front line. If we need specialists, we have plenty good specialists here in Pattaya as well.
And you enjoy working in Pattaya? You enjoy working in Thailand, I believe?
Yes.
More than where you're from Switzerland, right?
Yes, from
Yeah.
Geneva.
From Geneva. And how do you compare your working life?
I go once a year to Switzerland back and I meet my friends, doctors, and we compare how we work, and I have much less paperwork here in Thailand.
Okay.
And there is a thing which is very good. We have the medicines here in the medical clinics as well. In Switzerland, doctors, they have to make a prescription, then the people, they have to go to a pharmacy. Here I like because giving the medicine to the patient, we can explain how to take them, and it's part of the treatment that people understand well how to take the medicines.
So you can give more time to the patients, I believe.
Yes. And at the clinic we don't take appointment as well, so the patient just show up. Many patients, they are very surprised because they say, if they come from England, they say, oh, we have 4-5 months wait to see a doctor. In Switzerland maybe it's 1-2 months. Here they don't feel
Just
well,
show
they
up.
just show
Yeah,
up.
they
and
just
that's
show
it.
up and that's it. You have doctors ready to treat them.
If at the clinic, if there are many patients, maximum waiting time is 1.5 hours. If there is an emergency coming, so we can treat immediately.
So everything is easier here in Thailand. Both ways, for the patients and the doctors.
Yes, yes.
Thank you very much, doctor.
You're welcome.
Thank you.